Illicitly manufactured fentanyl by Michael Naranjo. Illicitly manufactured fentanyl, IMF, is a potent synthetic opioid, primarily responsible for current drug-related harms. Unlike medically used fentanyl, IMF is often mixed with other drugs, leading to unpredictable dosing and high overdose risk. Effective clinical assessment, overdose prevention, and evidence-based treatment are crucial in addressing this public health crisis. The history of illicitly manufactured fentanyl in the United States reveals its central role in the opioid epidemic. The 1990s and 2000s saw a rise in prescription opioids, followed by a heroin wave in the 2010s. By the mid-2010s, synthetic opioids like IMF surged due to their low cost and potency, leading to a toxic polysubstance drug supply. The Centers for Disease Control and Prevention reported a significant decline in United States overdose deaths from 2023 to 2024, with synthetic opioids, excluding methadone, showing one of the largest decreases. Despite this, illegally made fentanyl remains a primary driver of opioid-related fatalities, highlighting its persistent risk in the drug supply. Total overdose deaths were approximately 80,391 in 2024. In 2023, the National Survey on Drug Use and Health reported that approximately 828,000 individuals aged 12 and older misuse fentanyl, with 627,000 specifically using illegally made fentanyl. This represents about 0.3% and 0.2% of the population, respectively. However, actual exposure might be higher due to unawareness of fentanyl presence in counterfeit pills or other substances. Risk factors for fentanyl misuse include counterfeit pills, unknown drug supply, and mixing opioids with alcohol or benzodiazepines. Vulnerable populations are those with opioid use disorder, prior overdose history, adolescents, and individuals with unstable housing. Clinicians should inquire about pressed pills, drug sources, and recent tolerance changes to better assess risk. Opioid use can lead to both short-term and long-term effects. Acutely, patients may experience euphoria, sedation, and respiratory depression, potentially leading to overdose. Chronically, users develop tolerance, dependence, and face high relapse risks. Long-term use can also result in medical complications and psychosocial deterioration, significantly impacting mental health and overall well-being. Recognizing opioid intoxication or overdose involves identifying decreased consciousness, slow or absent respirations, and pinpoint pupils. Look for bradycardia, hypotension, and hypothermia. Evidence of use includes paraphernalia and track marks. History of counterfeit pills or recent detoxification increases risk. Immediate treatment with naloxone and ventilation is crucial to address suspected overdose. International Monetary Fund's lethality stems from its potency and inconsistent mixing, making small dosing errors potentially fatal. Rapid onset can lead to hypoxia, risking brain injury or death. Naloxone can reverse overdoses, but repeat doses may be necessary. Approximately 14% of suicide deaths involve intentional self-poisoning, highlighting the need to screen for suicidality post-overdose and implement safety plans. In cases of non-fatal overdose involving illicitly manufactured fentanyl, immediate care includes monitoring airway, breathing, circulation, and pulse oximetry. Assess for co-ingestions and perform toxicology testing if needed. Evaluate withdrawal symptoms, opioid use disorder severity, and readiness for change. Screen for suicidality and psychiatric risk. Initiate a linkage plan for medications for opioid use disorder access and ensure follow-up within 24-72 hours. Pharmacological treatment includes medications for opioid use disorder such as buprenorphine or methadone, which reduce mortality. Consider extended release naltrexone when feasible. Prescribe take-home naltrexone and treat co-occurring disorders. Non-pharmacological approaches involve motivational interviewing, cognitive behavioral therapy, and harm reduction counseling. Fentanyl test strips and addressing social needs like housing and transportation are crucial for comprehensive care. Educate patients on the hidden risks of International Monetary Fund in drugs and the importance of overdose recognition. Train them and their supports in naloxone use. Emphasize avoiding opioid mixing and using test doses. ensure rapid medication for opioid use disorder access and behavioral therapy with peer support and social work. Follow up within 72 hours post-overdose, checking naloxone supply regularly. International Monetary Fund's potency and concealment in the drug supply heighten overdose risks. Prioritize respiratory assessment and congestion evaluation. Key strategies include naloxone access, medications for opioid use disorder initiation and rapid care linkage, integrate harm reduction and suicide risk screening post-overdose, combining emergency response, evidence-based opioid use disorder medications, and practical harm reduction is crucial to saving lives. Here we have a list of references used for this presentation.